Welcome, everyone. It is noon, so we'll go ahead and get rolling. I'm going to pass it off to Evelyn Nelson to get us started here.
Thanks, Christine, and welcome, everyone. We're so glad to see you back here in March. We're excited to move forward with our All Under One Roof session today. I'm just starting us off with a few reminders. The session will be recorded, and that allows us to send the recording to you afterwards. Your microphones have been muted. Please do use the chat or unmute yourself. We'd love to hear from you with both your questions and your comments. Just a reminder, the certificates of attendance will be mailed at the end of the session. And with that, it's really helpful if everyone can type in their first and last names within the Zoom boxes. I'm seeing most folks have been able to do that. So that just helps us get your certificates out to you. And with that, I'm pleased to hand the baton to our two wonderful presenters today, Nicole Crump and Dana Bacula.
Thank you so much, Evelyn. As Evelyn's mentioned, my name is Dana Bacula. I'm a pediatric psychologist at Children's Mercy, Kansas City, and an assistant professor at the University of Missouri, Kansas City School of Medicine. And I work clinically and do research with families with children with complex medical conditions and do a lot of work around supporting parents and caregivers. Nicole, do you want to go ahead and introduce yourself too?
Sure. Hi, I'm Nicole Crump. I work at the University of Kansas Medical Center for the LIND Grant, Leadership, Education, and Neurodevelopmental and Related Disabilities. I provide administrative support for that program, among others, and I'm also the caregiver to a medically complex 7-year-old girl.
Great. Next slide. Okay, so our agenda today will go through some introduction and disclosures for our presentation today. We'll have a didactic presentation, and then we'll have an interactive demonstration towards the end. So we would love for your participation as we talk through some real world kind of clinical examples. So please do feel free, and we encourage you to jump in the chat or unmute yourself towards the end when we do that active demonstration. Next slide. We do not have any relevant financial disclosures. Next slide. And after the session, the slides will be sent to you, as will certificates. If you have any questions, you can email the Telehealth Rocks team with that email on the screen. Next slide. And I just wanted, Nicole and I wanted to start off today with a poll, simply acknowledging that in the first session, it seemed like a lot of you are here because of professional interest in supporting caregivers, but there also seem to be quite a few people with some type of lived or personal experience caregiving for a child with a medical condition. So if you feel comfortable sharing if that is the case for you, we would love to just open up a poll and see how many of you have some type of personal experience, whether it's your own child, maybe it's a niece or nephew, but I'm curious how many of those of you here have some type of experience like this.
So Dana, it looks like 22 of the 24 people have responded, and I'm not sure if you're seeing the results. 27% say yes and 73% say no. Yeah,
okay. Thank you all for responding. That's yeah, really good information. So yeah, it looks like it's up to 27%. So almost a third of people here have some type of personal or lived experience being a caregiver or caregiving. So thank you all for sharing that. And that also encourages us further to really say, please do speak up if you have thoughts or other things that you want to add. We really hope that this session, we're talking about kind of the professional ways that we can support families and caregivers, but I think a huge part of that is understanding that lived experience that it looks like a good percentage of you have. So please do feel free to speak up when you have thoughts or questions too. Okay, go ahead and move forward. Thanks for answering that question. So today we're talking about noticing, we're going to talk about noticing some red flags in terms of caregivers who are experiencing some signs of distress. We're going to talk about how to start conversations with caregivers when you notice some of these concerns. And then we'll also talk about a little bit more in depth what types of resources exist. So we shared a long list of resources after the first session, but we'll talk more about the types of resources and what those might look like and the pros and cons of different options. And then, like I said, towards the end, we'll do a demonstration. So we'll go ahead and start off with noticing some red flags that a caregiver might be struggling. And Nicole and I will kind of pass back and forth going through these, but Nicole, I'll let you get started with that first one.
Sure, thanks, Dana. So we don't often think of a traumatic stress response necessarily in medical caregiving or parenting, but we do want to highlight that you might see a traumatic stress response, which could look like intrusive memories or flashbacks, really big emotions in response to trauma reminders. Avoidance, such as trying to avoid talking about the trauma or avoiding people and places that are associated with the trauma. I know I do this all the time. Changes in mood, such as negative thoughts, hopelessness, and feeling detached. I think that's a very common one. And changes in physical reactions, including irritability, being easily frightened, trouble concentrating, and feeling on guard for danger. I can personally speak to this last one, just kind of that heightened, elevated response, where even if things are kind of calm, it's hard to fully kind of be present in the moment because you're almost waiting for the other shoe to drop because you have had that trauma experience in the past. Next slide, please.
Anxiety is another really common experience that caregivers of children with medical condition can go through. And so some signs that you might be able to see might be caregivers being really worried that things are worries that are really difficult to control. So you're starting to see that their worries are so big that they're having a tough time reining them in, or maybe you might see them asking a lot of additional questions and just having a lot of worries that they are having a hard time managing, being really restless or on edge. So sometimes anxiety presents in that physical manner where you see someone who is just really kind of restless or fidgety in their seat, being overly tired because anxiety is exhausting, having a difficult time concentrating, particularly if you're meeting with a family and trying to talk about big things going on with their child. Sometimes parents can present as if they're not focused or they're not paying attention. And sometimes we perceive that as they don't care, but in actuality, that can often be that they are anxious about something and they're having a difficult time concentrating, being really irritable, having really tense muscles. Those are all signs that we can notice that indicate some type of anxiety. And I do want to just add a note here when talking about anxiety specifically, which is that caregivers have a lot of worries and fears that are very normal and very valid. So when a caregiver has a child with a pretty significant medical condition, some of their fears might be about their child dying or about their child having a major medical consequence. And sometimes we have that impulse to say, oh, everything's going to be okay. Don't worry about it. Don't waste your time worrying about those things. And I just want to also acknowledge that sometimes those worries and fears are incredibly realistic. And so just acknowledging that seeing a parent who's worried about things may not be an indicator that they're having significant concerns with anxiety. It may be a realistic fear. So trying to really understand and walk the line of understanding the differences between those two. Next slide.
You might also see depression, and this can manifest in feeling overwhelmed and exhausted, not enjoying things that they used to enjoy, appetite changes, which some I probably wouldn't necessarily notice. It's not sleeping well or sleeping a lot, so maybe looking for just extreme fatigue, seeming slower to respond, difficulties with confidence, so maybe not speaking up like they used to in an IEP meeting or not having the same kinds of conversations that you're used to having with them. Expressing feelings of guilt, like, oh, I'm such a bad mom because this happened. I can't believe I let my kid experience this. And thoughts of suicide.
And I would also add, Nicole, I know you mentioned like we might not see the appetite changes. I will say sometimes parents have made offhand comments to me of like, oh yeah, I forgot to eat dinner again, or they'll make comments about not eating. And I think sometimes we don't always take those very seriously, but I found a lot of times when I ask follow-up questions of like, oh, does that happen a lot? Or when was the last time you had something to eat? Parents who are experiencing symptoms of depression might say that they're skipping meals all the time, every day. Maybe they haven't eaten since, it might be 2 p.m. and they haven't eaten since yesterday. Or they've started only eating one meal a day because they're just feeling nauseous and not hungry. And those can all be some of those more subtle and more difficult to pick up, but signs of experiencing depression. Okay, next slide. Grief is another thing that is really common. So we've talked about post-traumatic stress, anxiety, depression, and grief. I think these are some of the biggest things that tend to come up for caregivers of children with medical conditions, and grief is a significant sadness over something that was lost. I think we often think about grief as when someone dies, right? I think that's the most classic example of grief is we lose someone that we love and we experience a lot of grief over their loss. But what we see a lot in families who are caregiving for children with medical conditions is they experience grief over the life that they expected for their child, or they experience grief over a childhood or an element of that the child's experience that is lost or can never get back, or there's lots of different elements of grief that can come up for families, and it doesn't always have to be about someone dying. It can be about changes or different experiences that we expected and that not being the case. But when parents are struggling with grief, we may see that they're experiencing a lot of sadness. They're having a difficult time accepting current circumstances. So again, something we can misinterpret when we're in our professional roles is if we're trying to help a parent make changes or set up an IEP plan or set up a plan of some kind to help their child with a current difficulty their child is having. Sometimes parents can come across as if they don't agree or don't understand or don't see what we're seeing, and that can be frustrating. But sometimes that's truly, experiencing a lot of grief and still going through that grieving period of understanding changes that their child has had. It can present as lack of trust with others and with medical providers or school providers or social care providers. Difficulties remembering the positives can be really prevalent when parents are experiencing really acute grief, because there's so much grief about the things that were lost that it can be hard to have those positives come to the front of their minds. And then also things like feeling guilt, ruminating over things that they could have done differently. Those are often responses that we see with grief, and those might be things that you see in parents or caregivers that you work with.
And I'd also like to briefly touch on this idea of anticipatory grief. It's something that I experience a great deal of. And so, like Dana mentioned, it's not just the passing of a child, but mourning the loss of a life that could have been, or a future that you envisioned for yourself, your child, or your family. But it's also this idea that for a lot of us who have medically complex children, we know that we will outlive them, and kind of living in that space of when is it going to happen? How is it going to happen? I know it's coming and I don't know what to do about it. And so just giving space for parents to talk about some of those really big feelings. And it's a very specific, very different type of grief than you may be used to witnessing. Next slide, please. So there are a lot of ways that you can respond supportively if you do see these types of responses in families. I think first and foremost, recognizing them as trauma responses. I touched on this briefly earlier, but I never knew that I was experiencing trauma. And if somebody had told me a couple years ago that I had PTSD, I would have laughed at them. Like, that's just for soldiers. That's just for people who have been in accidents. But a lot of us have seen, heard, been through things that typical parents have not. And we have actually experienced medical trauma. So recognizing these responses as true trauma responses and validating that for us, I think, is the first and most important step. And like Dana mentioned earlier, when she was speaking about anxiety, recognizing that some of these fears and worries come from a super real place. So validating that, honoring that those fears and anxieties are coming from a place of this could and likely potentially will actually happen to my child, and not brushing them off or trying to sugarcoat things or always putting a positive spin. I think that's what a lot of people, and it's a human thing to want to connect and provide support and reassurance and comfort. But often that can look like a washing away of the reality of someone's situation and saying, no. And it's like, no, I want to be heard. I want you to know that this will happen to my kid and I'm terrified about it. How can you be in that space with me? I think this one is super important too, writing down critical information and communicating with families via multiple methods. I know if a trauma response is activated and I'm feeling particularly anxious, or I just cannot pay attention, or I'm so sad in one ear out the other, the ways that you might typically be able to communicate with me effectively just aren't working in particular moments. And so rather than assume that I'm not listening or assume that I did gather the information that you provided in a way that typically has been successful for us as a partnership, making sure that I got it. So following up with a voicemail or an email or even a text message, messaging me through some kind of portal if you communicate with your families that way, just to ensure that that communication loop is fully closed. Always keeping your tone calm and kind. That probably goes without saying, but I think it can get easy to match other people's emotional responses. And so if you are with a family who is particularly sad or irritable or frustrated or raising their voice, just kind of having that moment of reminder of this, they're potentially experiencing a trauma response. How can I keep myself super level so then hopefully they can match me? And empowering caregivers with resources, with verbalized support. I'm here for you. You can do this. This is hard, but we have supports and resources available to you that I would like to share with you. And I'll skip one, asking permission to share those resources with them. Not everybody is going to be in a stage in their life or a stage in their grief process or an emotionally regulated enough space to want to have that kind of dumped on them. So saying, I have stuff that I think could be helpful. Is it okay with you if we talk about those things? Or, and if it is okay, how would you like me to share those things with you? And respecting that boundary. And then creating a safe space that feels safe. So again, just using those words of affirmation, but not kind of sugarcoating things either, validating feelings. Even the physical aspects of a space, I think, can be important. Stepping away into a calmer, quieter room, closing the door, just making sure that people feel physically comfortable is also, I think, super important. Did you have anything to add, Dana?
No, I think that you covered all those points wonderfully.
Thanks. Next slide, please.
Okay. And to kind of expand on all of those things that Nicole just talked about in terms of ways that we can respond supportively, we wanted to create some type of roadmap of, how do we take that supportive response and actually turn that into starting a conversation with caregivers about how they are doing, asking them about their own personal experiences. And I know that this was something when we did that initial survey, people felt really comfortable talking with caregivers many people felt comfortable talking with caregivers about how they were doing, but then as we started asking, what about asking the question or what about sharing resources, that's where people started to feel like they had less and less strong comfort. So we wanted to create some type of roadmap for how do you start a conversation with a caregiver. If you start to notice some of these signs of distress, you start to notice some of these red flags, what do you do next? And so the first would always be to demonstrate trustworthiness. So this goes back to some of the things that Nicole touched on in the previous slide, but showing compassion, showing them that you care about them, that you have a genuine concern about them or their family or their child. People feel really differently about trusting you if they feel like you have some type of general concern about them and their well-being, and you're not just asking out of obligation or because it's on a checklist, but because you genuinely care. Making eye contact, sitting down with them, being at their same level if they're sitting. All of those are different kind of ways that you can show them with your actions and with your body language that you are someone who can be trustworthy. And I think there are probably an endless list of other examples as a way to demonstrate that you're a trustworthy person. If anyone in the chat wants to type in things that they have done to demonstrate trustworthiness, I'm sure you have lots of other great examples too. Of ways that you've done that. The second being then to start a conversation. So what's a specific question we can ask to get a conversation started? One example might be, I imagine it must be hard balancing everything on your plate right now. How are you doing? And really putting the emphasis on them. I think when we are in roles where our job is to care for a child, whether that's in a school, whether that's in a hospital or a community setting, often the jobs that we have are to focus on the child. And so these caregivers may not have many experiences where someone says, but how are you doing? And so that alone can be a really powerful question. Validating the caregiver's experience. So when they share something with you about how they're doing, making sure that they feel like that emotion is valid and that you're supporting them. So it makes sense to feel that way. This sounds like it's been a really difficult journey. Again, we don't have to fix it for them in that moment. We don't have to tell them it'll be okay and give them reassurances that may or may not be true. We can simply say that sounds really difficult and just validate that emotion that they're feeling as something that is normal and valid. And then the last being what Nicole also touched on, being ask permission and share resources available. So what we know from the scientific literature is that the best way to help people engage in some type of change and do something new to help themselves is we always want to ask permission before we start telling them about resources or next steps they could take. As Nicole mentioned, sometimes people are ready for that. They want resources, they want anything that you can offer them that will help them. And other times they feel like they're in a place where they are not ready for those right now. They're still feeling very overwhelmed, or maybe they already have resources and they have a plan in place and they don't need additional ones. But so always, you know, demonstrating the respect for that person, that they know what's best and they know what they need, and always asking permission before sharing anything with them.
And I'd like to speak personally to the power of this framework. I met Dana because she was a clinician who did all of these things in an appointment with myself and my daughter. We have since transitioned our relationship to a professional one since learning of our overlap and shared research interests, but this is exactly what she did in a clinical setting. And it was so noteworthy to me because it had never happened before. Anytime it happens now, even a version of it now, I notice it, I tune in, I trust that provider a lot more, I develop a better relationship with them. I brought this up to my husband and he said, oh my gosh, now that you mentioned it, nobody has ever asked me how I'm doing. And that's so sad because you have all of these built-in opportunities while you're already engaged with that person talking about their kid to just really simply turn it around and ask how they're doing. And to the resources piece too, even if someone already has the resource, I do this professionally, I feel like I'm very plugged in, but it sure is nice to be asked. And so just not ever assuming that somebody either does or does not have a situation under control, but just trying to say, I am here for you in whatever capacity that needs to look like right now.
Yeah, and I think this is a larger problem in caregivers in general, not even just caregivers of children with medical conditions. I read an article yesterday written by the wife of a individual who had undergone cancer treatment for 10 years and had a cardiac arrest, and his wife resuscitated him for 10 minutes with CPR to save his life, and had essentially been helping care for her husband for 15 years before a nurse asked her, how are you doing? And that was the first time in 15 years someone had asked her about herself, despite the fact that she had been going through this journey with her husband for 15 years and had been the one to perform 10 minutes of CPR after he had a heart attack. So anyways, I think this is part of a much larger conversation about how we care for and pay attention to those who are caring for others, and not just related to this conversation. Okay, next slide. So we wanted to talk a little bit more about some of the types of resources that we may offer to people or point them to. So we, after that first session, and if you don't have this, please reach out and let us know. But after the first session, we sent a long list of resources related to caregiver well-being and resources that we can point parents to or access ourselves to support families. And there are all kinds of different resources. So again, it can be kind of overwhelming looking at a long list and thinking like, okay, but where do I send this specific caregiver? Where do I send this specific family for support? And so we wanted to talk through what some of the different types of supports might be. And Nicole and I plan on going through that list and creating some more kind of refined resources to send you all after the last session of this ECHO, so more to come on that. But we wanted to talk through what some of the different options look like and share some of the pros and cons and things to be thinking of with each. So we broke them out into different subtypes. So the first being social support. So one type of resource that we might point a family to is helping them connect with other families who have similar experiences to them, who've gone through something similar. Often parents who maybe are a few years ahead of them in their journey and maybe can share some wisdom or some point tips, or maybe a family who's going through something very similar right at that same time and can offer, you know, just to sit with them in that experience and have some shared experiences together and support each other. An example of this would be like Children's Mercy has a Parents Offering Parent Support program that families can self-refer into and get connected with another family. It can include support groups or peer-to-peer networking, like just connecting one family to another. If you know two families that might have some similar experiences and might find value in connecting with each other. I think also the other element of social support that we can't undervalue is just those supportive interactions with you, right? If you are coming into contact with a family and the caregiver is struggling with their own well-being, those simple interactions of asking them how they're doing, putting the focus on them, demonstrating that you care about them, those are social support, that social support that you're providing to that family. And I also see some comments. So I know Nicole's going to talk about pros and cons of these, but I'll just read these comments really quick. So Amanda said, POPS is great. Mo Family to Family Resource Center and Families Together included, also good for one-to-one peer support because sometimes diseases are so rare you have to search nationally. That's fantastic. Thank you for the reminder of asking before sharing permission. I feel like I do all the other things, but sometimes I just say, here are the resources. I will put it in the D part, but don't always say it's okay to give. Is it okay if I give this to you? So thanks for that advice. Yeah, I totally agree. I think the people who are here in this meeting are here because you are helpers and you want to support families and you want to support people. So when you find a really good resource, you just want to share it with them. But Nicole and I were having a conversation yesterday about the overwhelming amount of resources there are online, all kinds of websites, podcasts, all kinds of different things that exist, and to be confronted with all of them, or even like, I think there are 4 books on the list that we sent you all. The likelihood that any family that we interact with is going to go home and read 4 books while managing their child's complex medical needs is pretty slim. So yeah, just thinking about how burdensome it can be to offer resources even when they're amazing. And then Peggy said, one thing I always did for parents of children with multiple IEP service providers was to make up a contact sheet with the team members' names, phone numbers, and email addresses. One time early in the school year, I had a parent email me saying she hadn't gotten the updated sheet yet. Obviously, she was using it. That's wonderful. I think, yeah, the more that we can make it easy to understand and navigate these systems is so powerful for families. Okay, Nicole, I'll pass it back over to you.
Yeah, definitely. Thank you for those comments too. I was just going to touch briefly on some of the pros and cons of each type of resource that we're going to go over today. So for social support, I think just bearing in mind, not everybody, depending on the complexity of their child, will be able to leave the house very often if it's an in-person gathering. Transportation can be a barrier, language can be a barrier. So just kind of depending on the community setting you're in and the type of family that you're working with, those are just considerations to maybe bear in mind. It can also, again, like I'll keep beating into the ground, depend greatly on the stage of this journey that a family is in. And depending on where that is, this could either be really emotionally fulfilling and validating, or it could be really terrifying and traumatizing, and you might be learning things that you weren't even aware were possibilities for someone with your child's disorder. So just kind of balancing those considerations. Next slide, please.
So the next type of resource would be online community. So that's somewhat similar to social support, but in a different way to get some of that. Online community can sometimes be interactive where you're going back and forth and having conversations, but there are often a lot of online communities where it's kind of a one-way flow of communication, more so than a two-way, whereas like meeting face-to-face with someone might feel very two-way. As opposed to following someone on Instagram or listening to a podcast or reading a blog. These can be really great resources because it's a way for families to connect with someone else, again, who may have some similar experiences, may have some different experiences, may have some insight that they can learn from or take away from, or simply can make a joke or make something like a meme or something that just helps normalize and humanize their real lived experiences. So I think these can be really powerful tools for families, but I'll let Nicole talk about maybe what the pros and cons are and when families might gravitate towards this versus something else.
Sure. So that's me, that terrible thing. That's a resource that I created, and I haven't kept it super up to date, but it's called CareWell Collaborative, and it was supposed to provide like caregiver wellness tips for folks. And I think what I have loved about online community is the ease of use, the accessibility. There's all of these different features and platforms where anybody anywhere in the world can find it. You can connect to people across the globe who you never otherwise would have. Somebody mentioned the rare disease thing. My kid is a super ultra rare disease, and I am friends with people in many, many countries because of that. Searching particular hashtags, finding very specific types of information. I think these sorts of things are really useful for. Some of the same pitfalls of potential re-traumatization if you're seeing a feed of images that are very difficult for you to see, or if you're connecting with families who you don't necessarily agree with the way that they're handling a situation, or it's making you question and doubt and have guilt about the way that you are parenting. I think that comparative culture can be really toxic. And so just that caution of how you're engaging, how often, and kind of respecting your own personal boundaries with use of that is super important to bear in mind.
Yeah, and I would even add, like, to add what you said, Nicole. I worked with a family who they followed a family's Instagram account that had a child with a similar type of complex medical condition as them. And that family was sharing a lot of like the positive aspects of family time and activities and all of these things that they were doing to support their child. And the parent that I was talking to didn't necessarily notice at first, but that was causing her a lot of stress and anxiety of like, I need to be matching that same standard with my child. I need to be doing as much as this parent is doing because look at what she's doing to care for her child and support her child. And I need to work harder to do the same. And then months later, that parent on Instagram that was shared the other side of her experience, said, you know, I feel like I haven't been sharing as much about the really hard things that we're going through and the times that I'm not doing well and how stressful it is to build all of this. And so and that ended up being really valuable for this mom that I was speaking with to see that side of the story. But I do think social media can be one-sided or it can be two-sided in terms of what you see from other families. And so just being aware of that and going in with that mindset of like, you may not see everything that a family is experiencing. And so it can be difficult if we compare ourselves to them. Okay, next slide. The next type of resource might be self-help resources. So there are a lot of different websites, either built by professional organizations or built by parent and community organizations that are really run by the community. And then there's a mixture of both. So Courageous Parents Network, that's the example on the screen here, is actually an example that's run by both professionals and the parent family community that resource serves. And so there are a lot of these types of resources, websites online, and then self-help books are another kind of example of a self-help resource. It's a book that someone can purchase. It has information about how to navigate certain difficult situations or how other people have navigated those situations and what they might take away from that. But so this type of resource is something that is often like you are pointing a family to and they are reading through information or watching videos or other things from an organization that has been created for the sake of helping them with something.
So what I love about this kind of thing, some pros, are that there's just so much great information out there. And it's really validating and encouraging to learn that organizations or individuals are compiling these types of resources. When you are initially diagnosed or confronted with a new and scary medical situation, you think, I'm alone in this, nobody else is out there doing this kind of work that's going to support me. And so to find it and know it's there is hugely validating and really encouraging. It's so much information that you can feel very lost. You don't know where to begin. You're kind of, again, diving into this ocean of the unknown. And again, I have been on Courageous Parents Network and stumbled upon things that actually were deeply triggering for me that I had to turn away from. And so there are aspects of it that I have used and enjoyed, and aspects that I know kind of what my limits are and what not to navigate to at a certain point. And so just making sure you as the provider, if you are recommending this to someone, is aware that as helpful as it may be, it can also be very overwhelming and potentially even an added source of stress, which seems counterintuitive. But I think when you go from this 0 to 60 model of resource dissemination, it can kind of, parents might not know what to do with that right away. Next slide, please.
The next type of resource would be pointing families to some type of healthcare resource. So sometimes the stress, anxiety, depression, or trauma symptoms that a caregiver is experiencing is so significant that they really do need some type of care for themselves that is really dedicated, where there's a trained professional that is supporting them above and beyond social support or self-help resources. So this may include pointing a family to their own adult physician. So maybe that's a primary care doctor or a psychiatrist. And those types of doctors can talk with families about medication management options. So are they experiencing so much anxiety and stress that they may need a medicine to help them manage it? They can also be a resource that maybe coordinates that the parent getting connected with other resources. So primary care doctors often are connected with or know therapists in the community and can help navigate with a parent or caregiver how to get access to some of those resources that might be helpful. Things like family therapy, where maybe the whole family is going together to see a therapist to talk about their experiences. Or maybe specifically parent-oriented therapy. So where the parent is the one receiving therapy and it is really focused on them and it is not focused on the family, but it is them meeting one-on-one with a therapist to talk about their own needs. And so these are kind of some general routes that we might point families to if they needed more traditional healthcare resources.
I would say pros that these work well. They're wildly helpful resources and tools for families. A lot of excellent takeaways can be gleaned from different forms of therapy or having these conversations with healthcare providers. The con or the caveat is just, again, can a family get there? Is there a telehealth option? What is the insurance billing situation like for them? Do they have other language resources available? So just kind of before you point them that way, making sure that you're pointing them in a very universally accessible direction. And I think that's about, I had something else, but it slipped my mind.
Sounds good. We can always come back if it comes back to you. Okay. I will say the one kind of downside to this that I will add is just cost. Mental health care coverage is not always phenomenal for families. And so there can be added cost both in transportation, but also getting reimbursement for services or finding a qualified therapist that takes that family's insurance can be very complicated and very confusing to navigate. As a psychologist, I often am helping families navigate how to find a therapist for themselves, and I struggle to always find good, well-qualified for the concern that they're looking for. Therapists that take their insurance or take insurance at all can be a challenge. And so even just thinking through, you know, am I prepared to point this family to some resources that might help them navigate this? Is this an option for them? Things like that are important to consider. So, okay, next slide. And then this last type of resource we'll talk about is respite care, which is the having someone else care for the child for a designated period of time to give the parents a break. And I will let Nicole talk a little bit more about this.
Sure. So this is a delicate and sensitive one, and also a passion project of mine that I'm independently pursuing outside of this work. Respite care is amazing. It can really refuel and recharge a caregiver and be absolutely beneficial for mental health and kind of getting back to a place where a caregiver could take better care of their child and have a better relationship with them. Unfortunately, especially in Kansas, it's tremendously difficult to find and fund. So just being aware that often the suggestion even of respite can be kind of a borderline insulting thing, like, ha, of course, but who's paying for it? Who am I going to hire? How am I possibly going to trust another person with my kid? It's a really complex and nuanced situation and suggestion often. So just wanted to kind of throw that out there. I did find this sort of 9 steps to respite care handout that can be helpful in kind of getting some ideas for what respite might look like and some ideas of how to fund it for families. Again, it's discouraging that this brief, handout is still 9 steps that families have. That onus is still on them to seek this out. So there's a lot of work to be done in this area, admittedly. But I would also encourage families to rethink what respite could look like. It doesn't have to necessarily be a state-funded thing where a nurse is coming and they're getting very specific type of care, and it's at specific times. It can be training a neighbor or a friend or a grandparent, and it can be just arranging for 1 hour so you can go to the grocery store by yourself, and reevaluating how to make that a priority in your life so that you can recharge and refuel. It just might not look exactly like you would ideally want it to, but still trying to really capitalize on those opportunities where they exist. Next slide, please.
So at this point, we want to pause for any questions that you might have, or similar, some people have shared like pearls of wisdom or their own thoughts or what they're doing in the chat. I just want to pause and take a few minutes to take any questions related to any of the things that we covered today before we do that interactive kind of case examples portion of our echo today. Please feel free to send it in the chat or unmute yourself if you have any thoughts you want to share or any questions. We'll go ahead and do this. So this case example is a mother of a 6-year-old with cerebral palsy. The child uses a wheelchair and is the only child in the school with a physical disability. You are the child's teacher and you're holding parent-teacher conferences. During the meeting, you bring up barriers you see in the school environment that have prevented the child from participating in recess and other school social activities. You want to brainstorm with the parent about modifications to the environment that might help the child. When you bring this up, the parent becomes tearful and sad. So the questions we have for all of you, and I would love people to pipe up either by unmuting yourself or sending an option in the chat, is how might you start out by demonstrating trustworthiness in the conversation that you have with this parent?
I think you would have to own the limitations that your school environment sets. Because I'm just thinking, I have an 8-year-old with cerebral palsy and uses a wheelchair, and the school has like every accommodation in place that we would need for him to be able to participate in all those different activities. And so I think acknowledging the limitations that you have, and then also exhibiting the interest and desire to make improvements in the school so that they can participate, I think would be a good place to start.
I think that's fantastic. Thank you, Stephanie. Great. How might we start a conversation with this parent about their own well-being and how they're doing? What could we ask?
I think it's appropriate to, the students can probably have an IEP. You can always have an amendment added or things that need to be in place, but maybe at a later time, maybe at this conference, it maybe with that emotion there, maybe set up a time to be mindful of that emotion and set that time for another time to meet to have that discussion. But setting yourself up to dive in too deep at that moment might not be appropriate.
Yeah, that's a great example, right? If you're on a time schedule, if you only have so much time to have this conversation with the parent, maybe the more pressing thing is saying like, I'm noticing that this is a really tough thing to talk about. Tell me a little bit about how you're doing, right? And reframe the focus of that conversation and let them know you will come back to this conversation, but right now you want to talk about how they're doing. If that caregiver shares with you that they are terrified that their child is not going to be able to make friends or grow up and have the same life that they expected for their child before they were born, with lots of social activities, and that they feel worried that their child's disability limits their interactions with other kids or how other children view them, How might you validate their experience?
I would say just empathizing with how hard it clearly is and letting them know they're not alone. And you know, if you've had other families that have had similar experience, just stating that to know that they're not isolated in that.
Yeah, totally agree. Simple as that. I love that. Okay. And then for the sake of time, I'll say right at the end, if we have resources we want to share, we first ask permission. We say, you know, I have some ideas of things that other parents have found really helpful. Do you want me to share them with you? How would you like me to share them with you? Things like that, as Nicole mentioned earlier. Okay, well, thank you so much for chiming in, and those of you who spoke up and participated in this quick case demonstration. So go ahead and advance the slides, Christy, up beyond our case examples. So our key takeaways from today: red flags for caregivers, that they're experiencing distress. Some may be obvious, some may be subtle. Starting a conversation can be as simple as asking a question and spending a few moments listening, and different resources may be helpful for different caregivers. Next slide. And we will meet again in a month on the 13th of April at noon, and slides and materials will be sent to your email after today. And the topic we'll be talking about next time will be having difficult conversations with caregivers. And we look forward to seeing you all then. So thank you to everyone for participating today.
Thank you all.